Hi, grade 4 students. I'm Dr. Aishan Kulaman, an orthodontist. I'm started this year with you the orthodontic lecture. First lectures is about the introduction to orthodontics. What do you mean by orthodontic? Orthodontic continue from two words that mean correct straight of the tooth. Most more details of this definition that orthodontic is a branch of dentistry concerned with the facial growth, with development of the dentition. That means you know how the time of the eruption and with the occlusion, the ideal occlusion, and with the diagnosis and treatment of malocclusion. And the study of the orthodontic includes the growth, development, and function of the total orthofacial complex. Also, you must know the orthodontic techniques are concerned with the techniques for treatment of malocclusion. So, the orthodontic that mean occlusion and face. Why orthodontics? Why this branch will be appear? Because there is crowding. You see these teeth, they don't have the space to see what happened in the mouth. So there is this that means there is a malocclusion, so need treatment. What do you mean by malocclusion, or what do you mean by occlusion? There is a classification. It's angle classification. It's related to the molar relationship. It's a class 1, class 2 division 1, class 2 division 2, and class 3. In more details, class 1, when you see here to the molar relationship, this is class 1, but they have anterior crowding, that's mean class 1 malocclusion. This here, the upper first molar, the mesial buccal cusp of the upper molar is included to the mesial fossa of the lower first molar. This is class 1 malocclusion. Class 2 malocclusion, here you see the upper first molar and more mesially to the lower first molar, and they have two types. Division 1, you see there is an overjet, increase the overjet, and in division 2 you see there is a deep bite, increase of the deep bite. The final tip of class or malocclusion is class 3 malocclusion. You see here the upper first molar is more distally to the lower first molar, and you see there is underjet, not overjet. Okay, this is class 3 malocclusion. Who needs orthodontic treatment? If the patient or some person they have a poor facial appearance, risk of the caries is crowding lead to the caries because they can't brush his teeth. Also, they lead to the periodontal problems. They can't do dental floss. Also, there is psychological disturbance because of his teeth. They can't smile, so they feel his psychological. They have a psychological problem for this. Also, you need if there is a spacing between the teeth. It's called diastema. So you need orthodontic treatment to close this space. Also, some persons they have oral habits like thumb sucking or lip thrust, so they need also orthodontic treatment. Or some other patient because of occlusion, they have speech defects, so they need to correct it. Also, the risk of the trauma, especially in class 2 malocclusion in division 2, when you remember, you see there is a deep bite, increased deep bite, so the lower incisor teeth will be occluded to the soft tissue of the maxilla. Also, they need the cleft lip and palate patient, they need treatment. Also, the TM joint problems, they need to treatment of orthodontic. Steps for orthodontic diagnosis and treatment planning. There is a three steps. First of all, you taking information from the patient. You talking with the patient. And the second one is the information obtained from the clinical examination. We have sheets You take information from clinically. You see, look into the tooth, you look into the tongue, lips, thickness of the lip, or, length of the lip. Also, you check the asymmetry of the face. Also, the third step is examination of the diagnostic recording, like dental models. You take an impression from the patient and you do cast, and you take in the radiograph and you take in photographs for the patient. First step is taken in first. Here you given this sheet to the patient. He follow this sheet. You must talking with the patient. You because sometimes when you check the patient, you see some problems, but the patient they see another problems. Okay, firstly you need to see the opinion of the patient. After that, you turn to the interoral examination. I told you, you check it if they have you check it the teeth, you check it the lips, the tongue, and you check it if they have habits, bad habits, and you check it if they have muscles problems and TM joint checking. So caries, periodontal problem, all of this you check in by intraoral diagnosis. Taking extra oral photographs of the patient, you taken from the front and from profile. It's important to checking for this is photos is very important for us because we check it with the after the treatment. You see what the different. Okay, we can see here also in extraoral if there is asymmetric problems in the patient, and you see to the smile lines of the patients is photos is very important for us. And also we take him intraoral photographs from front and left and right and upper and lower. We check in what's the problem exactly, and we compare it with the post treatment. We take in radiographs. This is panoramic radiograph. You can check if the periodontal problem, if they have a caries, if they have third molars, they have a, you also check the length of the tooth. Is very important for us before starting of a treatment. Also, you take an anterior posterior and TM joint X-ray. Anterior posterior, we do tracing for it. We check in if they have asymmetric or if they have problems, defect in one side of the face. TM joint, you check in the condyle shapes, if it's in socket or not. So you can, according to all this information, you can decide which type of the treatment you do for your patient. Also, we take in lateral cephalometric X-ray. We do tracing for him. We see the position of the incisors, and we check in the position of the maxilla to the bone, and check in the position of the mandibula to the bone or with the face. Okay. Types of orthodontic treatment. There is 4 types. It's the preventive and interceptive, corrective, and surgical orthodontic treatments. What do you mean by preventive? Here, we started early in the baby or in the child. There is no any active orthodontic treatments. It's just we concerned with the restoration of the deciduous teeth or the oral hygiene of the baby, or we do fissure sealant for the new erupted teeth, or fluoride application. It's recommended every 6 months. Here, there is no any active treatment, just we try to preserve the deciduous teeth or newly erupted permanent teeth. Preventive orthodontic, here there is a problems, and we try to prevent these problems by they have early missing. In this slide you have see patient, they have early missing of the E or D, that we do space maintainer for him to protect the space. If you are not protected, or if you don't do this appliances, that mean the patient they have a problem in the future, like maybe they lose the space and erupted of the 5 or 4 in another position, so they need fixed orthodontic treatment. Also, you need in preventive orthodontic management of the enclosed tooth. Here you can see there is this teeth is enclosed. The need to extraction because they can't erupt. The permanent teeth they can't come in push this teeth down to erupted. So this is a problem because they lead to the crowding or the tooth, the permanent tooth, they erupted from another position or they stay inside, they will lead to be impacted. Also extraction of the supernumerary teeth. Here there is one tooth extra here is prevented the eruption of the two central incisors. So need to extraction of this supernumerary teeth. Interceptive orthodontic treatment. Here we start to do treatment for the patient. Sometimes you see there is no spaces in so need to serial extraction. That means step by step you extract it to maintain the teeth in straight ways, erupted without any crowding. Serial extraction is a little dangerous. It's just orthodontists they can do it. Okay. Interceptive orthodontic also they concerned with the correction of the development crossbite. Okay, control abnormal habits, space regaining, and removable of soft tissue or bony barrier to enable eruption of the teeth. Okay. This is removable appliances. They have crossbite. There is upper denture is smaller than the lower, so needed expansion. By this screw, we can do expansion for upper and the lower. Okay, this is removable appliances. This is also habit breaker here. They have a tongue thrust. They prevent the eruption of the upper and the lower incisors. The tongue prevent eruption. Also here you can see there is heavy or thick soft tissue that prevent the permanent central incisors from eruption, so they needed surgical incision to open space for the or open a window for central incisor to erupt it. Okay. In corrective orthodontic also you can do it in late mixed and early permanent teeth. Recognize the extensions of the malocclusion and the need for employing certain technical procedures to reduce or eliminate the problem. All I told you about this is a crossbite here, so needed expansion. This is fixed expansion. This is rapid expansion of the maxillary arch. In corrective also we can do it. This is appliance this is functional appliance. Functional appliance also can do it, headgear or face mask. This is actually this type of appliance you use it just during the growth of the patient. So you can start it from 9 years or 10 years till the 13, 14 years. You can use this type of appliances. So early treatment, early diagnosis of the patient is very, very important. Corrective orthodontics is fixed orthodontic treatment. You see here they have a crowding, they need to do expansion, they need to fix the bracket to straighten the teeth. Also, there is a surgical orthodontic, surgical by extraction or serial extraction or surgical exposure of the impacted teeth, or it's a phrenectomy or corticotomy or gingivoplasty or surgical correction of cleft lip and palate. Also, there is finally is orthognathic surgery. Orthognathic surgery, some patient you can see it as a severe class 2 or severe class 3. So this is a treatment of, you can treat it by cutting the bones to make it class 1 of the patient in both malocclusion. This means by orthognathic surgery is very, very dangerous procedure. They need to work orthodonty with the oral surgeon or plastic surgeon together. Also, there is we can treat the temporomandibular joint problems by make occlusal splint for them. Take we take impression and do this splint inside in the lab and insert it to the patient to make him relieve the stress from the TM joint. Also, by orthodontic, we can treat the cleft lip and palate. This is my patient. The baby come to you and this like this. They have spaces here. They have low noise, and we try to by this type of appliance is nasolabial molding treatment to minimize these spaces and to elevate the noise to make the surgery of this type of the patients easier and less defect with the less scarce tissue. Okay. In orthodontic also we can see there is a risk of this treatment like maybe the heavy force they lead to the root resorption, or if the patient they are not care with the brushing of the teeth, they will be need to the enamel classification. Like here, you see there is beginning of the caries. Also, they lead to the gingival swelling, gingivitis, or sometimes lead to the loss of the tooth vitality. So when you selected the patient for orthodontic treatment, you must be carefully, and we give him more and more instruction about the brushing, about the dental flossing, and about what they eat. It's very important. Also, in the risks of orthodontic treatment, there is some patients they have allergies to the nickels, because this is wire they contain nickel titanium, or they lead to also maybe they lead to the ulceration of the tissue or trauma. Also, incomplete treatment. Because the patient they will not come to the visit and they did not use in the you give them elastics they not use, they will not care about the treatment, so you can't finish with them, so you leave it in incomplete treatment. Also, after when you finish the treatment, we give them appliances to wear to maintain the teeth in stable. So if the patient don't care about it, they all the treatment there will be relapse. Patient not satisfied with the results. This is important. Most of the patient they don't understand what the orthodontic they do. The orthodontic they try to corrected the teeth, they try to correct the occlusion, they try to maintain the TM joint in health position, but the patient just care about the corrected teeth. Okay, so you must talk in a lot with the patient before starting. Also, home care for ortho patients. From the beginning we give him information or give him instruction. You must brush your teeth very well. You must brush your teeth after each eating. After you must do mouth washing after each drinking of juice or anything else. You are never drinking acidic, and there is no chocolate, there is no chips, there is no other hard food, sticky food, and you must use in two types of the brush. One is interdental brush, and the other one is orthodontic brush. It's like the normal brushing, but there's a difference in here. This is special for ortho. Also, they give him instruction or show him how they use the dental floss, because if they don't do this, or if they don't know about this from the orthodontist, all of the teeth they will be ended with the caries and with the gingivitis, and they will have a bad appearance. Okay. And thank you for listening. I know in this lecture maybe it's very hard for you. Maybe you have a lot of questions. Please watch this lecture, and if you have any question, I'm ready to answer it. I know it's very hard for you, but this is the beginning. I'm just giving you information about the ortho. This not not the it's not in the like this like a shock for you, I know, because I memorized the orthodontics in one lecture, but after that we try with you simple okay. Maybe I given this lecture, maybe most of you they don't know what they mean by ortho. For this I'm sorry about it. So you see it, okay, and check what you have a problem, what do you have a question. I'm ready to answer you in Tuesday 8:30 till 9:30 we have am. We have a lecture with you. I wait you. Okay, see you. Bye.